Now we go into MVP. That's what you are. Now, the most valuable regurgitation or most valuable prolapse is the following. So what the picture on the left is showing you mitral valve prolapse, but this is thickness. And this is due to what's known as myxomatous degeneration. And the myxomatous degeneration is, an interesting topic because really, what is MVP? Mitral valve prolapse. Keep this separate from mitral regurgitation. But Dr. Roger, both systolic murmurs. I agree, 100%. But this is not going to be a holosystolic murmur. So a holosystolic murmur is mitral regurgitation. Mitral valve prolapse is something called a mid-systolic click. So what's my problem? Literally, it's the mitral valve, which is then going to prolapse. And if you take a look at the echo, it'll exactly do this. Here's my mitral valve, and here's my left ventricle, and here's my left atrium. It's going to prolapse just like that into left atrium. And when you do so, this left valve or mitral valve looks like a parachute. It literally looks like a parachute. You have the chordate tendonae, which is then trying to hang on to the mitral valve, just like that, trying to hold on. And so therefore you find this mid-systolic click. Is the click the murmur? What are you talking about, Dr. Raj? Now, this is what you want to do so that you don't miss any questions. You take a look at mitral valve prolapse and you divide it and dissect it into 4 different components. And then you apply certain maneuvers. And when you do so, it'll all come together. 4 different components, yes. 2 are normal and 2 are pathologic. The 2 that are normal, S1, S2. Clear? Right off the back. S1, S2. Let's knock that out. Next, it's a systolic murmur. What does that mean? You're having issues with closing, right? And the only way that you could have a mitral valve disease and it being systolic is problem with closing. So it could either be mitral regurg, or in this case, it'd be mid-systolic click. My point is, all murmurs between S1 and S2 are systolic. This is a click. That's the third component. So you have S1, S2, in the middle, we have a click somewhere. That's the third component. Then we have the murmur. The click is not the murmur? No. Why is that important? Because in pharmacology, for management MVP, you do everything in your power, in our power, to reduce the amount of murmur. You want that or murmur to be reduced for management. And I'll tell you right off the back, the number one recommendation that you'll be doing to a young lady that has mitral valve prolapse, exercise. Really. Because when you exercise, what happens to vasoconstriction? Actually, I just gave it away. So you do have vasoconstriction with exercise. Vasoconstriction, you have to. How else do you have increased preload? You do. How do you have increased cardiac output? Vasoconstriction. Once again, in exercise, what happens to arteriole? Dilate. So you decrease your afterload and you have vasoconstriction. You pay attention to increased vasoconstriction. When you do so, you have increased venous return. You, as a doctor, seeing a young lady with mitral valve prolapse, you recommend exercise. When you recommend exercise, what are you doing to that murmur? What did I tell you that you want to do? What is your objective to create for MVP? To reduce the amount of murmur after that click. And by increasing the preload in your heart, the murmur after that click is going to be reduced. Voila. You have helped your patient probably forevermore. It's amazing. If that doesn't work, I'll take you to the next step of management. Let's continue. So here we go. 7% of the population. That's quite high, MVP. Keep it separate from mitral regurg. I beg of you. Myxomatous degeneration. I showed you a picture previously with myxomatous degeneration. We have thickening of the mitral valve. Primary disorder, it could occur genetically. Associated with connective tissue disease such as Marfan, once again, Ehlers-Danlos. Mostly benign, asymptomatic, but worst case scenario, you're thinking about syncope issues and chest pain, especially with anxiety. MVP. And mid-systolic click. Hey, doc, I feel like my heart is palpating. Hey, doc, I feel like my heart is going to jump out of my chest. You know, those are things that your patients are going to then express to you.